Hi everyone, this is Dr. Farida Rajan Ibrahim Omasundi, and today we are going to discuss sickle cell disease. So I'm going to look at the causes, the symptoms, complications, and types. If you haven't liked, please do like, share, and subscribe. So what is sickle cell disease? So sickle cell disease is a group of inherited red blood cell disorders that is caused by a mutation in the B globin gene that results in the production of abnormal hemoglobin S, which is HbS, when oxygen levels are low. HbS causes red blood cells to become rigid and sickle-shaped, which blocks blood flow and leads to multiple complications. So coming to the genetics, this is an autosomal recessive inheritance pattern, which means that a person must inherit 2 copies of the sickle gene HbSS, one from each parent, to have the disease. So inheriting one sickle gene and one normal gene, HbAS, results in sickle cell trait, and these people usually are carriers and they are mostly asymptomatic. So what are the types of sickle cell disease? So there are mainly 3. The first one is HbSS, which is sickle cell anemia and is the most severe form. And then we can also have the HbSC, where there's one sickle gene and one gene for hemoglobin C. And then we have the HbSB or HbSB thalassemia, where there's a sickle gene and beta thalassemia gene. And there are also other rare combinations. So coming to the pathophysiology, we know that there is low oxygen. In low oxygen conditions, HbS will polymerize, making red blood cells rigid and crescent-shaped. So these sickled cells are less flexible, causing blockage in small blood vessels, where we can now have vessel occlusion. And these have a shorter lifespan, because mostly red blood cells are supposed to last for 120 days, but for them mostly it's 20 days. So these lead to hemolytic anemia, and repeated sickling causes chronic inflammation, organ damage, and pain crisis. So what are the clinical features? So for early symptoms, mostly especially in children, there is dactylitis, where there is pain or swelling in hands and feet. There is delayed growth and frequent infections. And then what are the common signs and symptoms? So we can go by system. So the general manifestations though are fatigue, pallor, jaundice, and the like. And then there's also pain. Mostly in this case, there's pain, which can be acute vessel occlusion crisis, especially in bones. We can also have pain in the chest, in the abdomen. And for hematological symptoms, manifestations, mostly we have hemolytic anemia, and we can also have recurrent infections due to functional asplenia. And for the chest, we can experience acute chest syndrome, which is life-threatening. For neurological manifestations, we can have things such as stroke, especially in children. For GUT, we can have things such as priapism, which is painful prolonged erection. And then for others, other manifestations, we can have delayed puberty, gallstones, or leg ulcers. So coming to the investigations, for screening and diagnosis, we can do a sickling test, hemoglobin electrophoresis, which confirms the diagnosis. We can do a full blood count, which can show anemia. You can do a peripheral blood smear, where you can have things such as sickle-shaped RBCs in appearance. You can also do your liver function test to assess organ function. Those are just some of the things you can do. And for management, you can divide it into acute management and chronic management. So for acute management, mostly if the patient comes in crisis, you have to treat that. So for pain relief in crisis, you can offer your IV fluids, analgesics, or oxygen in cases where they are hypoxic. For acute chest syndrome, you can also offer your oxygen, antibiotics, bronchodilators. If infections, you can treat with empirical antibiotics. Yeah, and for chronic management, this is where you give things such as the folic acid to support red blood cell production. You can give your hydroxyurea. Yeah, you can also give your penicillin prophylaxis in children to prevent infections. There's also transfusions you can give in cases for severe anemia. Yeah. So what's the complication of sickle cell disease? So for vascular complications, like I already said, you can have things such as stroke, pulmonary hypertension. Hematological complications, you can have a plastic crisis. You can also have damaged organs leading to kidney failure, retinopathy, or vascular necrosis. Yeah, so those are just some of the things that I wanted us to discuss today. So just know that you have to screen it early and avoid triggers, especially cold weather, dehydration, infections. So you have to encourage hydration, a healthy diet, and routine follow-up. Yeah, so for the prognosis, with proper care, many patients survive into adulthood. Yeah, so that's just a short, brief discussion on sickle cell disease. See you in the next video. Make sure you share, like, subscribe. Thank you.